My next guest, Dr. James Pickney II. He's a board-certified family medicine physician. Dr. James studied general surgery at the prestigious Cedars-Sinai Medical Center in L.A., and after graduating from Baylor College of Medicine in Houston, he's the founder and CEO of something called Diamond Physicians, and now they call it a concierge medical practice. That sounds a little too uppity, really, for my taste, for what it actually is. Basically, it's medical care without all the middlemen. Diamond bypasses cumbersome and inefficient folks like the folks that I call the traitorous insurance companies to give quality care. Dr. James Pickney, first off, happy Thanksgiving and welcome back to WBAP.
Hey, thanks for having me on the show. Happy Thanksgiving.
All right, hey, are you on a speakerphone or are you on a handset?
I'm on a handset.
Are you on a you must be in an echoey room. I mean, you are echoing big time. It's all right. We can understand what you're saying.
How's this? A little better?
Well, yeah, that's much better. Thank you very much. So, talk to me about this. What do you make of? And I don't want you to get into the politics, but now you get a sense the Democrats are retreating from Obamacare because they understand that the math didn't work, is not currently working, and will not work in the future. So they're looking to put a good deal of distance between their political party and the law they passed. Give us a brief synopsis as why you know Obamacare will not work, and then kind of outline a solution.
Well, the problem with the Affordable Care Act is that it's based on a premise that insurance companies can actually deliver a decent product. So right now, for instance, in 2010, Blue Cross Blue Shield had 232 different types of insurance that consumers could choose from. Now they have 13. There's no cost transparency. There's no free market. We are forced to buy a product that is subpar and doesn't offer anything. The services are terrible. So physicians don't take these products. So now you have this insurance policy, and you can't get care.
And
so
Dr. James, can I interrupt just briefly, because a report came out the other day that stated these insurance companies have vowed to fight any Republican effort to either change or to replace Obamacare because they're making money hand over fist because of Obamacare. That's why they jumped in bed with Obama and the Democrats to get this passed, because they're making money like crazy.
That is 100% correct, Chris. The feds are going to pay the 5 major payers, Aetna, Blue Cross Blue Shield, Cigna, United, and Humana, $2 trillion over the next decade in subsidized funds. That's $200 billion a year. Do you know what I could do with $200 billion a year? I could completely transform the face of healthcare in this country and deliver affordable care to every U.S. citizen.
Yeah, I don't doubt that you could. Dr. James Pickney of Diamond Physicians is my guest right now, and here's the reason why I kind of like what you're doing and other entrepreneurs are doing, because, like I said, it eliminates the cost of having that insurance middleman in there. And it's what medicine is supposed to be. It's you and your doc, and you guys are coming to an agreement about what they will pay. If there's a catastrophic loss, you can buy a relatively inexpensive catastrophic loss policy that just in case you get cancer, you're hit by a bus, all the stuff they said Obamacare was going to solve but doesn't. But you can do it in a relatively inexpensive way and no government subsidy is needed.
Yeah, that's right. It's just like car insurance or home insurance. When you fill up your car with gasoline, you don't put a claim on the insurance company. You pay cash. When you need new tires, new windshield wipers, and oil change, you pay cash. And that's why insurance premiums for your car insurance are reasonable. Instead, in the medical side of things, we use it for everything, every office visit, every flu shot. We should pay cash for the maintenance and use catastrophic insurance for surgeries, for hospitalizations, for cancer treatments, things of that nature.
That is a great way to put it. I don't think I've ever heard you put it quite that way with the car maintenance analogy. And because that's going to be the number one criticism of what you do is that what if I need a surgery? What if I need this? What if I need that? And it's like, well, yeah, there's a lot of what ifs, but I would say an overwhelming percentage of your medical care are the basics, are what you call maintenance, your physicals, your simple blood drawn. Maybe you get a bad cold and you need an antibiotic, that kind of thing. And your services are perfect for that.
Absolutely. 95% of the time we can take care of things in our office. So we offer an 80 to 90% discounts on labs and imaging. So instead of charging $5,000 for an MRI, Diamond clients receive that MRI for $400. CBC, $5 instead of $80. Cholesterol check, $6 instead of $128. The markup is atrocious, Chris. It's unbelievable what these insurance companies have done to the healthcare market.
No, that's true, and they've completely distorted it because the insurance companies are a form of subsidizing. And when folks, there's a political axiom out there, and it actually works in government, works in business. If you want less of something, tax it. If you want more of something, subsidize it. And well, we're getting higher prices courtesy of the subsidizing of medicine through the insurance companies and also through the federal government's intervention as well. So, Dr. James, first off, outline to folks how much you charge in your particular service per month, and what are the ranges there? Because you get a menu, right?
Yeah, absolutely. We charge a monthly membership fee. Kids start at $45 a month. Adults start at $95 to $295 a month. So for a couple $100 a month, you get unlimited visits, no copay, 24-hour access to your physician. You have my cell phone number, my email. Text me as you wish. We can FaceTime. We can Skype. We can do all these things to take care of your problems efficiently. You're also going to receive acute medications and acute procedures in our office, all included. So if you cut yourself and you need a laceration repair, you come in, I stitch you up, it's included for that couple $100 a month. If you have a stomach bug and you need IV fluids, nausea medication, you come in, you use our urgent care facility, and it's all included.
Dr. James, I've never asked you this question before, but and I've interviewed other people like you, other medical entrepreneurs who are doing things, who are carving out their niches as well. I think I told you once about a guy who was doing house calls, a business he started up, and they're charging a monthly fee to come to your place and do this kind of stuff. Another guy doing very much what you're doing in the middle of New York City and making it work. And a lot of people are finding that it's cheaper to go with companies like Diamond Physicians than buy Obamacare.
Oh, absolutely. It's much less expensive to go with Diamond. We're going to save you at least 60% across the board. And our next step is, you talked about surgeries and a catastrophic policy. Well, there is a cash pay surgery center in Oklahoma City, and I am trying to bring that model to Dallas, Texas. It's unbelievable. They publish their prices online. You can go in there and get a knee replacement for $5,000 instead of $45,000.
Wow.
And that's what we need to do to lower the cost of healthcare globally. Introduce cost transparency to the market and let competition take place.
That's a beautiful thing. Dr. James Pickney II, Diamond Physicians, where can they go if they want to find out more information about what it is you do?
Go to diamondphysicians.com. We have limited availability, just 500 clients per doctor. So please give us a call, 214-395-3491, and follow me on Twitter at @the_Dr. James.
Well, first off, I've got to thank your family and your wife. I know you're traveling, and I stole you away from your holiday celebration. So thank your folks, thank your family, and thanks for being here on the Chris Crock Show with me, Chris Salcedo.
Oh, thanks for having me on the show. Happy Thanksgiving.
All right, Dr. James, you too.